An easy way to remember is stroke is sort of heart attack of the brain. There is some sort of compromise to blood flow to part of the brain, and that compromise leads to loss of brain function. We have very high prevalence of stroke, and this is typically referred to as stroke belt. Not only that, the incidence and the prevalence of stroke is high, but unfortunately also the mortality of the stroke is high. The benefit of early treatment is preventing the long-term disability, in addition to preventing mortality. And the long-term disability is highly dependent on the size of the stroke and the part of the brain that's affected. The common problems that we see in patients with strokes are weakness on one side, or the numbness, or the problem speaking. African Americans are not only at higher risk of stroke, but they're also at higher risk of having poor outcomes. And the reason for that are basically they have higher incidences of hypertension, high rates of diabetes, high rates of high cholesterol, and the combination of that increases their risk for stroke. With COVID, we have noticed increase in the rates of stroke. It's not only about having the higher prevalence of stroke, but it's also about seeing stroke in younger patients. So at the peak of COVID, my colleagues and myself have noticed higher number of patients who are young, do not have vascular risk factors, and they were having strokes. And certainly we think that the COVID, just like any other infection, increases your risk of forming blood clots in the body, and in turn can lead to higher rates of stroke. When we think of stroke, we have to think of B fast. B for balance issues, E for eye problems, F for facial weakness, A for arm and the leg weakness or numbness, S for the speech problems, and T is time to call 911 and get to the emergency department as soon as possible.